are going to continue joining. But in lieu of time, I'd love to get started. Thank you for joining us today. I know many of you who are on this call that I recognize have heard a little bit about Cure Teams or know a lot of bit about Cure Teams and the different ways that you can get involved as a volunteer with HealthTree. But if this is your first rodeo and learning about it, welcome. If it's your second or third, I'm glad you're here to continue learning. Or if you're supporting in different ways, we will connect with each other along the way. But first and foremost, I'll introduce myself. My name is Taryn Placco, and I am the Community Engagement Manager at HealthTree. And I'm so thrilled to be leading out this program, which is the HealthTree Regional Cure Teams, our newest volunteer arm of the organization. Many of you may be familiar with our coaching program, which was the first volunteer opportunity for folks to contribute to HealthTree. And now with the HealthTree Regional Cure Teams, we are just offering a plethora of ways for you to get involved in your own community from your own home to help us reach as many patients as possible as we go out and share the incredible resources and programs that we offer here at HealthTree. So what you can expect today, let me just get rolling over here. We're going to do a few introductions from our team that we have here today. And then really working through the why behind the Cure Teams, the mission of the Cure Teams and our structure, how we support you out in your community. We have a lot of different leadership roles across the nation that support you wherever you live, the different ways that you can connect with each other through HealthTree Connect. And then we'll do, depending on how many folks join us today, we may break out or we may stay together, we'll see. But we'll be doing some Q&A. So if you have questions about what are these Cure Teams, how can I get involved, we would love to hear from you. And we want to make sure that we answer all of your questions. So that is what you can expect for today. So I will just go ahead and jump in. If you've just joined us, we'd love to hear where you're calling in from. So please drop in the chat where you are. All right. Next. Oh, this is my video. Okay. I'm going to share a short video. This is just a brief summary of what the Cure Teams are and how you can get involved. Whether you're a patient, caregiver, friend, or neighbor, HealthTree Regional Cure Teams offer a variety of opportunities for you to get involved. HealthTree Regional Cure Teams are a network of passionate volunteers who are dedicated to contributing to a cure for blood cancer through action and meaningful connection. Cure Team members can get involved in whatever capacity fits their life and can focus their efforts on supporting outreach, fundraising, and HealthTree Cure Hub awareness and participation. Each Cure Team is unique based on the needs, resources, and challenges faced within the specific group. Cure Teams provide support, connect members with one another, host and attend events, share resources and experiences, and more. There are 6 regional Cure Teams across the nation: Pacific, Rocky Mountain, Southwest, Midwest, Northeast, and Southeast. As a member of a HealthTree Regional Cure Team, you can get matched with a volunteer opportunity that fits your schedule and area of interest. You can share resources with your community, present on the importance of HealthTree Cure Hub and invite local patients to participate, create your own fundraiser or support other fundraisers taking place in your region, serve at local health events, support Black, Hispanic, and rural patient outreach, connect with other patients, caregivers, and community partners across the nation through HealthTree Connect, and find true joy in volunteering. Regional Cure Teams are launching in 2025. If you want to contribute to cures for blood cancer, please consider joining a Regional Cure Team today. Whether you're a patient, we don't need to see that again. All right. Just wanted to showcase, this is a list of our HealthTree community team and some of our events teammates that are here on the call today. Just wanted to provide that list. I'm sure you know some of us, many of us, all of us, or perhaps none, but we are thrilled that you are here and we want to support you in whatever ways that you need support at the organization. So our team over community, we have our Black Health Program, Financial Advocacy Program, coaching, and then with the Regional Cure Teams, the volunteer program. So we also have Marisol, and I don't know, is Mary Lou on the call today as well?
I
From
think
our
she
event
just
team.
joined, but I'm not sure.
Yeah. We're all here to support you and answer questions along the way. Um, I'll just dive right in. So our cure teams are really supporting the organization. We have had tremendous growth and a lot of growth within our staff at the organization in the last year or so. But we know that we have a lot more work to do, and we need to enlist the support of generous volunteers who have been coming to us for a long time and saying, what else can I do in my community? How can I get resources into other patients' hands? And so that's what the cure teams are built to do, is be a true extension of us and get deeper into the community and support as many patients as possible with sharing resources that we offer, connecting to other partners, local community resources, sharing the importance of HealthTree Cure Hub registry and what that can do for a patient as well as other patients, fundraise for the organization, just any way that people want to get involved as a volunteer to help us get closer to cures, we would love to have you here. So our cure team's mission really supports the vision of HealthTree, which is we envision a world where every patient and researcher has access to that essential data they need to make informed treatment decisions and to discover cures. So a little breakdown of what the cure teams look like. As I mentioned, true extension of our team. We know that having a network of volunteers out in the community to support in the various ways that we would love to see growth is the best way possible to connect with as many people as possible. So we have a number of different ways for you to get involved, and I'll share in some further slides what those look like. But here's just a few ways that you can support the organization and support others in your community, is just connecting newly diagnosed individuals to HealthTree resources, whether that's our HealthTree University education arm of the organization, patient-to-patient connections within community, or getting connected with our HealthTree Cure Hub. We'd love support in identifying clinics or care teams that may not know anything about HealthTree, providing those materials that we offer at our organization in those local clinics so that other patients can learn about the different resources that we offer, introducing our team to potential partners, supporting fundraisers within your community that support the organization here as well. Just as much connection and awareness that we can spread throughout the communities, specifically within the Black community or Hispanic community in those rural areas of the country. We find a lot of folks just don't have the same access or awareness of the resources that are available to them. So we know that building trust a lot of times comes through that peer-to-peer connection. And although Jenny and our team has built tremendous amount of trust with a constituent base and the community that follows us along, we know that we can go even deeper with the support from volunteers like you who help build that trust peer-to-peer. So anybody who wants to get involved on a cure team or involved with HealthTree, whether you've got a little bit of time or a lot of time, we welcome you, and we'd love to find and share opportunities with you and help you choose what would be the most meaningful in your life. So the three big buckets that we need support are outreach and partnership efforts, HealthTree Cure Hub participation, so just sharing, educating others on what Cure Hub is, how it can support them, how it can support others, and how it can further research along more swiftly, and then also fundraising. So these are kind of the big three buckets that we have various volunteer opportunities. And then, of course, we're always looking for new ideas, and the more conversations that we have with folks in the community and what their journey looked like to either a diagnosis or obstacles or struggles is really helping us shape other ways that we can better connect patients and build out volunteer opportunities that support those needs. You don't have to read all of this, but these are just some of the things that we've identified as ways to help support us in those different buckets. So clinic or healthcare provider outreach. So if you're interested in, you visit your clinic, you chat with people there and just sharing resources, materials with other patients or your care teams. Or even connecting if you have great relationships with your providers, whether it's your physician or a nurse, whatever the team looks like. Willingness to share the resources that we offer here is huge and helps us connect more and get those right resources into the patient's hands at that clinic level. Cure Hub support, we have a lot of folks on our team and as volunteers who serve as Cure Hub leaders, and they're certified in Cure Hub, sharing and can present on the importance of that and help people get in and connected. But also just, sharing the materials that we have around Cure Hub, what that means, and inviting others to participate is really important as well. Patient outreach. This is probably one of our most popular areas that people are looking to get involved. And that's really just connecting with others. People love to share their story. They love to hear other stories. They love to connect and see what resources are working for one person versus another. And there's a number of ways that you can do that. So whether that's if you're a part of a support group already and just sharing resources there, whether it's, getting involved in local events within your own community. If it's a health fair, you have opportunities to host a table and share resources there. If it's spreading awareness in the Black community, if there are specific events in your area that are geared towards health and wellness in the Black community, we have great opportunities for you to get involved in that capacity. But we're really open to ideas. I know a lot of folks who I've spoken to recently who live in more rural areas, the journey getting to that diagnosis was long, and it was seeing a lot of those support health services that you may not think of. So looking at those physical, psychological, social, spiritual support services that may benefit from learning about the different ways that HealthTree can support somebody who is maybe coming upon a diagnosis of a blood cancer diagnosis. Then lastly, fundraising support. So whether you yourself want to host a fundraiser where proceeds benefit the organization, or if you just want to support other fundraisers taking place in your region that are supporting us, we are also going to be hosting our first pilot fundraiser in the fall in the Northeast, where we're looking for support and volunteers. We'd love to have more people understand the different ways that they can also donate to the organization, whether that's through legacy gifts or IRA distributions. There's a lot of ways that people can support us, and we welcome all dollars in any form. So those are some of the more in-depth ways people can get involved, but that doesn't limit you from other ideas. But also wanted to share the breakdown of the organizations, of the regional cure teams. We have them broken down by regions. They are very large regions, but we do have a great way to provide a structure around that with some leadership to support you no matter where you live. But these are the 6 regions: Pacific, Rocky Mountain, Southwest, Northeast, Southwest, and the Midwest. And jumping into our leadership. So we have leader opportunities within each of those 6 regions. Each region has captains, co-captains, and then leads that look over and facilitate opportunities within each of those core areas. So if it's HealthTree Cure Hub, patient or clinic outreach, financial advocacy support, Black health, Hispanic health awareness, and then fundraising. So whether you just want to volunteer with a little bit of time that you have that supports one of these areas, or if you want to take on one of those leadership roles to help connect the dots for other volunteers in your region, there's opportunities all across the country in each of these areas. So we do have a number of committed leaders across the country already who are already doing a lot of great work and connecting with everybody who's been joining the Cure teams. But we still are looking for some leadership in key areas, which I can talk about in a little bit. But leaders are really that support to the volunteers. They help us at the organization track different progress, see where we have a presence and where we're making an impact, getting deeper into the communities. We're doing more than we've ever done to get into the communities and talk to more patients now through the Cure teams than ever before. So we're really excited to have that support. Another great way to stay connected with the fellow volunteers in your region is through HealthTree Connect, which is our social media platform. So that's no matter when you join a Cure team, you'll be dropped into that Connect group for your region, and you can connect with other volunteers there, share different things that you're doing, maybe share different events that are taking place. And you can really, it's just a space and a place for you to make your own. We have created, our team has created incredible, in-depth, resourceful toolkits that are in each of those areas. So Cure Hub, outreach, financial advocacy, Black health, fundraising. We've got toolkits for everything that you can access in Connect. And we can also send you electronic versions outside of Connect if that's preferred. But we want to make sure that you feel equipped with the right language and resources to go out into your community and share in whatever capacity you feel like sharing. But of course, we welcome creativity. And if there's things that you think need tweaking, we want to hear from you. So always, come to us if there's questions or concerns or ideas. We would love to hear from you. So as I mentioned, we are looking for leaders. So I will say right now, we do not have any captains, co-captains in the Midwest or the Rocky Mountain regions. So if you want to learn a little bit more about that, you can reach out to me after today's call. And we do have opportunities for these other leaders across all the regions. So if there's something that piques your interest, I'd be happy to share what those roles and responsibilities look like for those leaders later on. I did touch on HealthTree Connect. So again, this is the space and the place for you to join, to connect with other people, learn about each other, share best practices. There's a lot that you can see there. But next, we really wanted a bulk of this meeting to be dedicated for you to answer questions. So I know we've got a smaller group today, so I think it might be best if we just stay together. How does everyone feel about that? Does everyone feel okay about that? Okay, so Marisol, I'm not sure if we need our poll, but I think we could probably just stay here and start answering questions if people have them.
Yeah, sure. We can launch it just so we know how many people we have for each region, and then just instead of launching the groups, we can stay here.
Sounds great. Thanks.
Okay, give me 1 second. Okay, I think it's there, right? We only have 3 votes. Well, no, yeah, I think we're ready. I'll finish the poll so we know. We have 6 participants from the Northeast or Southeast region, 1 from the Midwest or Southwest, and 3 for the Pacific or Rocky Mountain.
Great. All right, well, we're just going to have a big old meeting today with all of us. I think that's going to be best. And this is really the opportunity for you. If you have questions, go ahead. You can either raise your hand if you feel more comfortable, or you could just come off of mute and ask it.
Yes, I have a question. How much, or no, what do you have training available for the leadership positions?
Oh, that's a great question. Yes. So all of our leaders, they will go through a training with myself and or another member of our team, depending on what leadership role they're taking on. So every leader will do an hour training with me, and it's really just to get you acquainted with all the resources that you have access to in different ways. It's really being a dot connector for everyone else within the region. So that 1 hour training with me, and then let's say you are looking at getting to be a Cure Hub lead, there are additional trainings that you need to go through to become Cure Hub certified. And similarly, if you're looking at financial leadership, there's a certification that you need to go through for those 2 leadership roles. But yes, that's a great question. And one other thing I'll share for our leaders, if there's anyone that's interested, is the leaders do come together with our team on a somewhat regular basis in the beginning, but we are hoping that our leaders do come together with each other for their regions once a month. They've also started to host their own meet and greets within the region, so volunteers can start getting to know each other virtually and talking through the different needs and ways that people can go out in their communities, share what they're doing, what progress that they've been making. So that's a little bit more in depth, but to answer your question, yes, we have training and resources, and we have Google Drives where they can access certain materials that we can all share between each other. Great question. Thank you.
Thank you. Kind of a follow-up question. How much time are we looking at it as a leader? Like 1 hour?
You're breaking up just a little bit, but I think I heard how much time should you expect? Is that for just any volunteer or a leadership role specifically? I could touch on both. If you were looking for leadership into a leadership position, it's kind of ebbing and flowing right now. Being this is a brand new program, all of our leaders have been really diving in and helping us just find what works best. But in the beginning, we ask our leaders when members are joining to do just a direct outreach. So if some of you are already part of a cure team, you may have received a personalized outreach from one of our leaders, just welcoming you, offering up an opportunity to connect one-on-one, share a little bit about yourself, and share where you might be interested in getting involved. So depending on how many leaders you have in your region and how many volunteers there are, it's just kind of dividing and conquering and doing some specific outreach to really just be better connected with each other. But I would say probably 3 to 6 hours a month. It might be an average because we do ask that those leaders come together for a 1 hour meeting each month with each other just to track metrics and report out what's happening within the region. If some regions are doing, like I mentioned, we just had a couple meet and greets this week. That was an hour that they brought everyone together. And then just individual outreach if they're also supporting a specific area. It really can depend on how much you want to do. But I would say, to be safe, approximately 3 to 6 hours a month. For anyone else that's volunteering in the region, if you've got 10 minutes a month and you want to support, that is perfectly okay. I think it really depends on what you might be interested in doing, and whether or not you can even, leave your home at this time, or if you want to get out in the community, if there's maybe a local event that you want to attend on our behalf, and represent HealthTree, kind of be that ambassador. That could probably be a couple hours out of your day, depending on how much of that you want to do. If it's something where you're just helping us build and identify, new opportunities, maybe it's clinics or, different events to attend. I think it really ebbs and flows, and that depends on how much you want to give. So it's funny, one of our colleagues likes to compare it to the PTA. So whether you're just a parent who wants to contribute a little bit, or if you want to be on the PTA and, do a little bit more work, that's kind of the analogy that we like to use.
Taryn, if you are a captain or a co-leader or something, what does that mean? What would you do?
So our captains and our co-leads, those are really the dot connectors for everyone else. So our captains, for instance, they're really, I'd like to call them the gatherer and the leaders of our leads. So they are bringing together the leaders once a month, and we have provided from our team guided agendas for them to cover each month, what metrics that they could be tracking. So like I shared, when new members have been joining the Cure team, since this is brand new, our captains and our leaders have been reaching out to folks based off of what they checked their interests are. So when you go to join a Cure team on our website, there's a series of questions that you'll be asked, just general, contact information, but also we ask you if there's any areas of interest you have in supporting us. So if you check, let's say, fundraising, our fundraising lead from that region will reach out to you and just try to connect and see what opportunities there might be for you or what you might be interested in doing. And then, they do come together, but we ask that our leaders commit to being in that role for 2 years. Of course, we know life happens. So if that's something that needs to be adjusted, we can certainly have those discussions, but just to have some consistency with those leaders. If they want to stay in that role for longer, we can have those discussions as well. But we also, our team at HealthTree meets with the leaders on a quarterly basis to really just talk through and shift things and work through metrics as well. But outside of that, they're really just kind of that liaison between HealthTree and everybody else in the community who's helping us. So
Thank you.
You're welcome.
Oh, one more question. Do you know, is there a walk or fundraiser in Colorado in the Rocky Mountain region? Is one already developed? Because I haven't seen anything about it.
Yeah, we don't have any walks that we produce across the country. The only event that we're producing in 2025 is going to be our new hike and wellness series, which I believe you'll start hearing about maybe later this week or next week. And that's taking place in the Berkshires in Massachusetts this year. However, we do have incredible platforms and resources if people want to put on their own events and have HealthTree as a beneficiary. So if there's, events taking place that somebody's doing like a peer-to-peer fundraiser, they can utilize our platform. And we are going to start showcasing those in the different Connect groups. If there's something taking place in your region, we'll certainly share that with you, whether it's, put on by another volunteer. But I think that that's something that we're going to start seeing more of. It's newer for us to offer the tools and resources for people to do that on our behalf. But we already have a few people who've signed up to do things for us across the country. But at this time, I'm not aware of any in your area.
Okay, thank you.
Yeah, you're welcome. If you're interested in getting one started, though, I have a lot of experience and I'm happy to help you get it going. Great question. So I'll share, we've had a few folks since we've launched the Cure Teams. It's been only a couple of months. But for instance, I'll just give you a couple of examples of what people have been doing already. Like I said earlier, the patient outreach has been a really popular area that people want to just connect with others and share the resources. We had a volunteer up in New York last weekend who was able to attend just a local oncology type fair. And so we sent her a bunch of materials and she was able to have a table and share all those materials and talk to patients and had a really incredible time and also said that, I'd love to do this again if there's other opportunities. And we encourage you, if you see something in your community and you're not sure if it would be a good fit to represent HealthTree, just reach out to us and we'll be happy to let you know. But we do have ways for you to request materials from us. And if that's something you're looking to do, let me think what else. We have some folks who are really interested in just talking to their care teams, where they have really good relationships with their local oncologists and their specialists. And we found that, Jenny's made a lot of great relationships and knows, we think, almost everybody, but there's still a lot of folks out there that just don't know who we are yet. And even just talking about the different ways that you've been supported by the different programs that we offer, whether that's, sharing that with your care team is also can go a long way too, if they're unfamiliar with our organization and what we do. Another way that people have been supporting, we have a few Cure Hub leads. I know Darlene's with us today. She is one of the HealthTree coaches and certified in Cure Hub. So she's done some additional trainings too, where we do presentations on Cure Hub, how it was created, why it was created, how important it is for patients, and how it's important for research efforts as well. And so Darlene's equipped to go out and present to, if it's a local community group or a support group. But you don't have to be Cure Hub certified to support Cure Hub awareness. We do have different materials too that you can share. I know we've got printed things. We've got things with QR codes that you can ask to, leave in maybe a clinic or a waiting room. There's a lot of different ways that you could support each of these areas. I don't know if anyone is here from the Northeast that was able to attend their gathering, their meet and greet this week. If there is, I'd love to hear just your experience, what that was like. I heard there was quite a few people and a lot of great conversation. One thing I didn't mention earlier, but I don't want you to miss is that the cure teams are across all blood cancers. So I'm sure many of you are, familiar. HealthTree was really founded for multiple myeloma. However, for the last, gosh, I don't know how many months it's been now, at least 18 months, maybe. We have expanded across all blood cancers. So the cure teams are supporting all. And of course, we know that if you're connected to a specific type, that may be what motivates you to get out and share resources with your community and with other patients with that same type. However, just know that you're supporting all, and some folks are part of an oncology clinic that maybe sees multiple cancers, and that's also a great space to share information.
Tara and I was on the Northwest call, and it was great. We just had icebreakers. It was a lot of collegiality. People got to know one another. We talked a little bit about our hobbies and kind of the real life beyond just the diagnosis stuff. We got to know each other. It was really good.
Oh, that's great. Thanks for sharing that. Yeah, I know we had our Pacific region hosted a meet and greet this week just with everybody who's part of that cure team. The Northeast hosted one, and I know the Southeast is hosting one next Tuesday. So if you're interested if you live in that area and you want to join that meet and greet, it's a great way for you to see, who's already in that region, what the volunteer opportunities are, what the different leadership roles look like that are available. And I'll also be hosting one for the Midwest and the Rocky Mountain regions in the next couple of weeks too, for anybody that's a part of those regions already, just so we can get to work and share the different gaps that we have, areas that we need support, and the different roles that are available, and just to get to know each other. And I believe the Southwest is hosting theirs on the 25th. I need to double check that though. But so yeah, the cure teams are a space, of course, for you to contribute and get out and support things that we are looking to expand on, but also for yourself and for each other to build that community. And we encourage, if you have folks in your region that are near you, meet up, go to an event together, or we just want to make sure that people feel connected. Any other questions or anything that I might be missing if my teammates want to jump in?
I just have one question and no pressure if people don't want to respond, but I'm curious, for those who have joined a cure team, what made them want to get involved?
Good question.
I'm kind of putting a few people on the spot. I don't know, Patrick
Oh,
and
yeah.
Darlene. If you would be willing to share, I'm just curious, what made you decide to get involved with the cure team?
Oh yeah, Pat Kelly. So I'm co-captain for the Southeast team, and it was just the exciting opportunity to get involved from the groundbreaking level to build it out, to grow it. Just an exciting golden opportunity. And I volunteer to get outside of myself. And I'm also a health tree coach and financial coach. I coach about 50 patients, and I'm retired, so I have time. And nevertheless, with all those coaches, I still have time to be a co-captain, and I definitely recommend it, encourage it.
Thanks, Patrick. Go ahead, Darlene, if you.
I was just going to say, almost like Patrick, I'm a HealthTree coach. I've been with HealthTree since 2018, and the opportunity to talk about Cure Hub and bring in volunteers or patients to join our Cure Hub is exciting to me, because Cure Hub is just, I think, an awesome tool that we have with HealthTree. And that's why I joined, so we can spread the word.
Thanks,
Thank
Darlene.
you. I
I
know I
know.
totally put you on the spot, so thanks for being willing to share.
You don't have to be a HealthTree coach or a financial coach or a certified Cure Hub to, join or be a leader. I know if he was here, he would share that we have a leader, a captain in the Pacific who, upon a very new diagnosis, just jumped in and said, I want to get involved and tell me what I can do. And he's here with us. So that's really exciting. And so whether you're new to HealthTree or you've been around for a long time, and you are welcome to join and support us. And really, we want to support you so that, again, the goal is just to meet every patient where they are and provide the resources that are going to help them along the way. So one other thing I was going to share, it was escaping me now for a moment. We have another program that is new for the organization. It's called Connect to Cures, and it is going to be an in-person community event. We're going to be coming to 10 different cities across the country this year. We have the spring/summer, early summer. We've got 4 locations that we are coming to. 3 happen to be in the Southeast region, and then 1 in the Midwest. So we are looking for patients who are interested in sharing their experience on a panel. And the panel could be talking about their experience with a clinical trial or bispecific CAR T, different types of therapies like that at these different in-person events. The event is really geared toward patients to help connect them in a number of ways, connect them to care. So if you happen to live in a more rural community, learning how a partnership between your local oncologist and maybe an academic specialist, how that's really beneficial for you. Learning how you can connect better to research, and that's really through hearing about those different patient stories, connecting to resources in those communities. So we are gathering a bunch of other local support services where we're coming to be almost a resource fair where attendees can just walk through and experience and learn and gather resources from those various organizations. And then also connecting to community, connecting to each other, offering a space disease specific for those attendees to go and connect with other patients who, are maybe battling similar obstacles, or just sharing stories and sharing about their experience on different therapies, things like that. So we are coming first to Macon, Georgia on May 31st. Shortly after that, we'll be in Peoria, Illinois, Central Illinois on June 7th. And then we'll be going back to the Southeast, Orlando, Florida on June 28th. And then up to Harrisonburg, Virginia on July 26th. So more to come. We'll be posting more information about those events. But if you happen to live near one of those areas and you're interested in either sharing flyers once we have those ready to go, or sitting on one of those patient panels, we would love you to support us there. But a lot of dates and more locations to come once we have those. We'll be sharing them out with everyone too. But that's another way that volunteers can get involved. Great. Well, I hope that this has been helpful for you if you've joined today. And if there's any questions, if you're not comfortable sharing with the group, you can reach out to me. I'm going to drop my email into the chat here. But I will certainly be staying on, and if others want to stay on and they have questions, feel free to stay and ask. If you feel like you've got everything out of what you wanted to say, no worries, you can jump off, but we will be here to continue answering questions. Oh, thank you, Mary Lou. My email's in the chat if you'd like to reach out directly. One other thing I'll share, we are looking for leaders, of course, in all the regions, and we aren't limiting it to just one of each role. So Patrick shared that he is he's a co-captain in the Southeast, so he has another co-captain in his region. And we've got, for instance, Darlene, she's one of our Cure Hub leads in the Pacific. There's also another Cure Hub lead in the Pacific. We'd love to have, two at least of each leader role in each region to support all of the volunteers that are kind of falling into those different buckets to help spread awareness. So there's a lot of opportunities, whether you want to be a leader. Yeah. Oh, thanks, Robin.
Hey, Taryn, I had a question. What are the next steps from here? Like, so I'm in the Northeast. Can I expect to get followed up from the leader of the Northeast region, talk more specifically about what's going on in this neck of the woods?
Yeah, so I cannot see who's actually speaking.
It's Jim. I'm in here as Jay, I guess. You only get my first initial.
Hi, Jim. Thanks for asking. That's a great question. So if you leave the meeting today, there will be a pop-up for a survey, and in that it's like a 4-question survey. And one of the questions is, are you interested in joining a Cure team? You can be linked to our website where you can join. Otherwise, we can also drop the link to that website in the chat here right now. But yes, once you join a Cure team, the leader from that region will reach out to you and try to connect one-on-one. If you're interested in a leadership role, you can connect with me and I'd be happy to talk through what those are and share like really the finite, description and details of that. And yeah, so, thank you, Marisol. I think she dropped the link to the survey. And then I can also drop the link directly to the Cure team web page. I hope that answered your question.
Yeah, I did. Thank you.
You're welcome. All right, here, the link to the survey is in the chat, and then I just linked the Cure Team website page where you can just learn more, and then you can choose your region, and it asks you just a few questions. And once you answer those questions, you automatically get dropped into our Connect group for that region. So if you're in the Northeast, you'll fall into the Northeast region and you'll see the different conversation that's been, happening over there. You can connect with folks individually or in like the group chat. So you'll see different events that are taking place eventually. And just keep in mind, this is a brand new program, so there may not be a whole lot there yet. But in time, we're going to have a lot more conversation and things happening over there.
Irene, just so you know, we have a couple of questions in the chat.
Oh, great. Let me open that up again.
Okay, so they ask about, they would love to hear more about the opportunities in their region, and if they're interested, where do they sign up to a leadership program?
Okay, if you're interested in just joining the Cure team, I'm just going to drop it in again. This link is to our website, and I can actually show my screen if that's more helpful. I'm a very visual person, so that might be helpful. Can you all see this? Join a regional Cure team page. So this is our landing page for the Cure teams. You can click on this drop down here and choose your region. If you happen to live in more than one place, you can join both regions. It's totally up to you. I'm just going to go into the Pacific here. It'll bring you to the Pacific page. If you scroll down, you can it has a little bit of description. It has some pictures of the leaders there. But simply just click on become a member, and it will actually ask you a few questions. But once you answer those questions, you will be dropped into, this is our Connect group for the Pacific region. So you can see just different events that I've shared or different conversations that other people are having. This is really a space and a place for you to discuss and share. And the other thing I should showcase is the toolkit button. So here where I talked about you have access to all those different toolkits and resources to feel equipped with going out and sharing and being, having the right verbiage, all of those you can click on in that connect group as well. And they're identified in those specific areas, but you just simply click on those and it will open up a PDF that you will also have links to click on and a ton of information. So I hope that answered the question. The other question was about leadership. So if you are interested in a leadership role, you can reach out to me directly. I'll just drop my email again into the chat. It's Taryn@healthtree.org. And I'd be happy to, depending on where you are, share the open roles with you and even send you the description of those or have a one-on-one conversation, whatever you're comfortable with.
Also,
Taryn?
me again. So they're wondering if so there's someone trying to reach out to Darlene. So she asked if you can provide your email address so they can get in contact with you, or if they can reach through the Pacific region.
Oh, okay. Oh, I see. Robin's interested in getting in touch with Darlene. Great. Yeah, and Robin, you just joined the Cure team, correct? I believe.
Yes. Yeah, I
Yes.
just saw this webinar was going to be held this morning. So, and I'm actually new to HealthTree as well.
Oh, great. Welcome. If you just joined the Cure team, so you should have landed where I just demoed that page. And yeah, you can see all the if you click on view members, there's a button
Yes.
and you can see all the different members and Darlene, if you want to find Robin, you could just like ping her and send her a message. You guys could connect there too. So that's really great. You know what, I'll share my screen one more time because I think that's a really helpful thing to see.
I just added my email to the chat.
Oh, thank you, Darlene.
Oh, thank you.
Yeah. So if y'all can see this again, I hope I'm sharing. Yeah. So let's just say this is the feed here. You can click on members over here and see everybody that's a part of your Cure team. And then if you click on these little like chat buttons, I can click on that and I can actually send a direct message to that person. So I'm just say hi to Dave again. I say hi to him a lot. Send that. And then it's kind of like your own little, Facebook Messenger, if you will. You can chat with everybody there. Hopefully that's helpful.
So I'm actually this is Robin again. I'm actually on that site and some of the links don't seem to be working. I did just also click on Dave and oh, I see. Well, I guess I just have to play with it. But I clicked on the events link and the toolkit link and nothing's happening. So maybe it's getting blocked on my end. I'll just play around with it a little bit.
Okay. Yeah, I know a little behind the scenes, we have some of our developers working and tweaking a few things, I believe, on this page today. So if you're experiencing any of those, that might be why.
Okay.
So apologies, but it should be working in time.
Okay, great. Thanks.
Yeah, you're welcome.
There was also another question from Tracy. So she said that she have emailed you before, and she's looking forward to finding out more about joining a Cure team. And she's grateful. So yeah.
Great. Thanks, Tracy. Yes, we will connect and I'm happy to anybody on this call. I'm happy to have one-on-one conversation with you and answer any questions you have. Okay, looks like Tracy's having issues with the links as well. You just joined the Southwest Cure team. And so Tracy, did you drop into the Connect group as well? And you're just having trouble with those links?
I'm not sure if I dropped into the Connect group or not. I'm getting familiar with the website, but I'm sure I'll figure it out.
Okay.
Taryn, what if you share your screen and just show them how to get to the links to the Connect group there? Or if you want to, I can share mine.
To join the Cure team or what? Sorry.
Yeah, or the Connect group, because I'm sure they'll find the Cure team's information there as well, right?
Yeah, do you mind sharing that, Marisol? Because I am still actually learning how to do that to look for.
Sure.
Thank
One
you.
second, because I have like 1,000 tabs open, so I don't want to confuse you. Okay. I'm sorry. Okay, here it is. Okay, so right now, 1 second. You see this, you usually won't see this banner, but right now when there's a live event happening, you'll see a banner and it's um, related to the disease you're registered for or the disease you assigned to your profile, you'll see a banner, right? So if you close it, you'll see here Education Community Cure Hub. So if you go to community, you'll see Connect here and also the coach program that was mentioned before. But if you click here on Connect, you will see list of the groups you joined before. I joined a bunch of them because we have many, right? But you can see here on Find Groups, and you can search for your region. Let's say Midwest Regional Cure Team or Northeast or etc. Right? So I think I joined the Southeast group yesterday. Yeah. So here we will be posting about events or important information. You could find the toolkit that was mentioned before here and the events that we'll have in your region in the near future. I think this is what we figured yesterday, that these buttons aren't working, but they should work maybe next week because they are fixing something that wasn't working for us. So, but here's where you'll be able to find them. And also, I believe the Cure team pages are here under Get Involved. But
Yes. Yeah, if you go to get involved, it would be a drop down to either, you can click on that, Marisol. Yeah, you can either, there's a number of things you can click on, but you can access the Cure Teams there as well. So get involved, and then under volunteer, you can either become a coach or join a regional Cure Team, which will bring you to that main landing page I shared earlier.
yeah, but that's how you find it if you don't have the link that we just shared. It's here, right under Get Involved and then join a regional Cure Team. And if you have any questions, you can always use the chat here, and we have our amazing patient navigators that are always available for you, and they can help you step by step with any questions you have. And we'll soon have something else that will that will help us with the questions and finding things. But yeah, this is how you can find the links, and if not, you can email us and we'll share whatever you need.
Yeah, thank you.
Let me ask Tanner about the button.
Yeah, we are so fortunate to have an incredible team of developers that can go in and fix things like that when we have a bug or an issue. So hopefully that will be fixed very quickly. Thank you so much for joining us, Tracy. I saw your message. And again, once you click the leave button, there will be a pop-up for a survey. If you have time, it's just a few questions. And also in that survey, there's going to be a link to where you can join the Cure team as well. So a lot of different ways for you to find that.
Taryn, hi. I'm sorry I joined late and I apologize if you talked about this already, but can you tell me more about the Pacific region that I might not, some information I might not be able to find on the website? I'm in San Francisco, not sure if there's a center or if there's activities are concentrated in one area.
Okay, great question, and thanks for joining us. So the Cure teams are really it's a brand new program for us. So this is our volunteer led, 100% volunteer driven arm of the organization. So really, we are empowering you no matter where you live. We've been building out a variety of opportunities for you to contribute in many different ways, no matter where you are. So we don't have any physical locations scattered throughout the country, but we do have leaders in the Pacific region already. So we have Jason Mook, who is our captain of the Pacific region. He is in, I believe, Southern Oregon. And then Darlene is our Cure Hub leader, and she is based in Las Vegas. And then we also have Dave Brock, who is another Cure Hub leader, and he is up in Spokane. So again, these regions are very large. We know that they span across a number of states, but the goal is to just have, a presence not only with our leaders, but our volunteers. We know that people live everywhere, every nook and cranny of this country. And if there's a way that we can equip them with, whatever resource that they want to contribute, whether it's just handing out materials or sharing more information about HealthTree, or going to support groups and sharing information about Cure Hub. I mean, there's a lot of different ways for folks to get involved. So we welcome your ideas. And if there's something specific to your community that you think would be a great opportunity, please let us know. We'd love to help you.
Thank you.
You're welcome.
We'd love to have you join us too.
Great. Thank you. Thank you.
And I think what's so great too is our leaders are starting to have those meet and greets. And I don't know if you missed this, Carolyn, but the Pacific just held their meet and greets for everybody who's already joined the region on Monday. So they just gathered, they all got to share a little bit about themselves, and then they talked about the different ways to volunteer, and if, answer any questions if people are not sure where to start. Some folks know exactly what they want to do and others don't know. They just say, well, what do you need help with? And so that's why we have a lot of different things that are, available for you to do. But I think that's just going to be a great way. And I know our regions who've already started to do the meet and greets are probably going to do more of those as time goes on too, so that people feel connected, virtually. Even though you have a place to connect online via HealthTree Connect, it's another way to see people, and especially if you're not in the same community or within, a driving distance. So
We
I think so.
have, oh, sorry. We have someone in the chat saying that they want to join a cure team, but they missed part of the program. So if you just repeat that, I'll reshare the page and the survey, but just explain.
Yes, of course. So it looks like you live in New Hampshire. Yeah, so no matter where you live, we have our cure teams are broken up by region. So up in New Hampshire, you'd be part of our Northeast region. Marisol's dropping into the chat that first link is just the survey for today's call. And there's going to be a question there about, do you want to join a cure team? You can click on that there, or the second link that she just shared. It will bring you to our landing page where you can join a care team as well. But would be happy to connect. Also, let me see if I can. Marisol, do you mind dropping my email in there again one more time? If you have any trouble, please email me directly.
Or if you, I'm not sure who is that because it says iPhone, but thanks, Marilu. But if you feel comfortable sharing your email here, whoever was asking about joining the Cure team, we can contact you as well. But since I don't see your name, I cannot find your information. Or you can message us, whatever's best for you. Yeah.
I know it's the top of the hour, so if you have to go, thank you for joining. I'm going to stick around for just a couple more minutes in case there's other questions, but I'm so happy we're all here. Appreciate your time, and we hope that we'll see you soon. Bye, Patrick.
30 plus years. Wow, that's exciting. I just copy your name and email, and I'll make sure we send you a message. Yeah. So whenever you leave, you'll also see the survey, and if not, you have it here. And yeah.
On Monday is starting.
Yeah.
On
hi.
Monday, when we held our meeting, there was still, I can't think of her name right now, but she was worried about our data again on how it's safe. And I don't know if Jason got a
Gray?
hold of you. Yeah. What's that?
Was it Lisa Gray?
I think so. Yeah. Did you get a hold of her or somebody? Or I just wondered, are we going to, I know we keep having meetings on how our data is. Is there going to be another, or how we can train it? I didn't know how to answer. I should know, but it keeps, I think it changes. But I tried to answer her best I could. Jason tried. So I think Jason was going to get a hold of you.
Yeah, Jason called me after your meeting. And it's funny because I had met with Lisa earlier
Okay.
on Monday, but she didn't mention that part to me. I do think it'll be best to because I think I may have shared Todd Foster's now in his new role.
Yeah.
And he really knows every back and
That's what I
forward
said.
Cure Hub. So I think that Todd is still in France this week. I'm not sure when he returns, but I think what would be best, since he'll be continuing to lead out those Cure Hub like update meetings, I think we should be more proactive and like get with him soon to like, make sure that you feel equipped to answer those questions,
Yeah.
that we're all on the same page again, because I know that that is something that we come across every so often. And even though we have language on our website, sometimes people want a little bit more
Yeah.
and more reassurance from us as well.
Maybe a cheat sheet or something that, a short that can help us out. I don't know.
Yeah,
We
just
can
really
go
more,
through.
with her, it sounded like from Jason's standpoint, it was more so, I don't know if she had experience with like a data breach or something.
I don't know if she has experience, but I know she has experience with other places that it might be. I don't know if she had a breach, but she had other places that she was part of that she wasn't comfortable with. But I tried to reassure her that HealthTree is safe. Our data is safe. It doesn't go anywhere. It stays anonymous.
Yeah.
But she's still hesitant about joining Cure Hub. So,
Okay.
and I'm not sure how many others out there. That's another question. I asked her, how many people here have Cure Hub, and that was her. Now, as volunteers, do they have to have a Cure Hub, or are they not required to have a Cure Hub?
No, we don't require anyone to have it. We just, if
We
people,
hope.
yeah, I mean, the hope is that everybody who is affected by blood cancer will join, just because, we obviously know, and many of you know, the benefits and how it's helped you as a patient and how it can help other patients, based off of the different surveys and the studies and the, everything that's combined, I guess, in that account.
Yeah.
I know some people use it just for specific reasons for their appointments and just to have everything there. Some people really get more in depth with, sharing in what's the word I'm looking for? Side effects, or looking for clinical trials. And now with our new clinical trial finder, that's an incredible tool that people have access to, and just how it can really help us get closer to cures based off of the research that's happening because of the data that we're able to capture there. So yeah, it's not a requirement. Long story short, you already know all these things.
Okay. That's all I have for today.
Thank you so much for joining, Darlene. I'm always grateful.
You.
Again, not required to come to these, but I'm so grateful when you do.
Oh, it's always educational for me anyway. So
I'm sure you're like, I've heard this story a million times.
No, because I get to hear what the other people, their volunteers or whatever are saying. So no, it helps. It helps.
Good.
Okay.
Great. Thanks.
All right. You guys have the rest of a good rest of your week.
Thanks. You as well.
All right. Bye.
Bye. Thank you, Marisol.
No problem. Bye.